Hello, my name is Daniel Richter, along with Danielle Gagne and Jared Campbell, and we are presenting our research poster titled The Survey of Non-HIV STDs in Adults Over 50. A 2014 article published in the New York Times, Sex and the Single Senior, suggested that there is a rise in sexually transmitted diseases in the geriatric 65 and older population. Seniors are living longer, healthier lives and are living in communities that resemble college dormitories. However, they are not using safe sex practices as many individuals may have multiple partners. The CDC's 2013 STD surveillance showed an increase in the prevalence of syphilis, gonorrhea, and chlamydia in adults over 55 years of age. Data reporting prevalence of non-HIV STDs in the older population is lacking, and obtaining such data could help establish trends and determine the cause of rising tendency, along with enhancing therapeutic measures. The objectives of this study are to evaluate the appropriateness of treatment used for non-HIV STDs in adults over the age of 50 that have been admitted to Tampa General Hospital from January 1, 2011 to January 1, 2015. Also, to estimate the prevalence of non-HIV STDs in single and married women over the age of 50. And lastly, to estimate the prevalence of non-HIV STDs in adults over the age of 50 living in long-term care facilities. This study used a retrospective chart review method to collect data from Tampa General Hospital's electronic health record system. Patients were included in the study if they were over the age of 50, had a non-HIV STD, and were admitted to TGH during the 4-year span, January 1, 2011 through January 1, 2015. Non-HIV STDs included syphilis, gonorrhea, chlamydia, herpes simplex 2, and human papillomavirus. For patients meeting the inclusion criteria, we collected patient identification number, age, sex, marital status, race, residence type, height, weight, serum creatinine level, and we estimated the creatinine clearance. We also collected tobacco, alcohol, and illicit substance use, and STD diagnosis, and the age at which the STD was diagnosed, along with past medications and current medications related to STD treatment. These data were collected to assess patient marital status, residence type, and the appropriateness of treatment.
After obtaining a complete list of patients admitted between January 1, 2011 and January 1, 2015 who had specific ICD-9 codes for non-HIV STDs, the total number of medical records reviewed was 1,061. Figure 1 shows the breakdown of the inclusion and exclusion criteria application. 719 patients were excluded based on having an age under 50. Several patients had ICD-9 codes that did not meet one of our diagnoses. For instance, patients who had herpes simplex infection may have had an ICD-9 code for herpes simplex 1, but we only accepted patients with herpes simplex 2. And some patients had an HIV diagnosis as a co-infection, and those patients were excluded as well. After all of the inclusion-exclusion criteria were applied, a total of 70 patients were used in the analyses. Table 1 shows the prevalence results for those 70 patients. Approximately half of the patients had herpes diagnosis, 11% with HPV, and 37% with syphilis of any stage. No patients were found to have gonorrhea or chlamydia. There were slightly more female patients than male patients, and the breakdown of STD prevalence by marital status is listed here as well. We will come back to this momentarily. This pie chart portrays the prevalence of the STDs that were seen in the included patients. As mentioned, there were only 3, with approximately 50% being herpes infection. Figure 3 shows the STD prevalence broken down by marital status. The data show that single patients have a higher prevalence of each type of STD, followed by married individuals.
Florida's population is one of the oldest in the United States, and so Tampa, Florida may be an ideal source for evaluating healthcare-related data in older adults. When evaluating treatment of non-HIV STDs in older adults, we found that of the 70 patients we included for analysis, 46 patients were documented as treated for their non-HIV STD and 24 were documented as not treated. Syphilis and herpes simplex 2 were mostly managed with the standard treatments of penicillin G or doxycycline and acyclovir and valacyclovir, respectively. We also found that non-HIV STDs were less prevalent in married women than in non-married women. The limitations in this study were primarily due to the incomplete profile documentation and to the retrospective nature of the study. These limitations include inability to consistently identify the age at STD diagnosis, which patients were living in long-term care facilities, exact indication for antimicrobials, accuracy of patient medication histories, and appropriateness of STD treatments in patients without flare-up. Due to the limited amount of non-HIV data in the elderly population, evaluating this data and appropriateness of treatment in these patients in the Tampa, Florida area could help predict trends throughout Florida, the southeastern United States, and possibly nationwide. It is our belief that future related research should include more accurately maintained patient data and/or prospective data collection methods.